All right, welcome everyone to the 2021 Benefits Open Enrollment presentation. My name is Anna Evans and I will be your host today. I'm with Holmes Murphy, Ogle County's Benefits Consultant Partner. Everyone should be muted automatically when you joined. Just to assist with background noise, we ask that you remain muted unless you have a question. And feel free to ask questions during the presentation. But that said, we do have some time for Q&A at the end of the presentation. You're also welcome to use the chat feature to ask a question if you would like, and we'll be sure to address those as well. Take note, like I mentioned a few minutes ago, this presentation is being recorded for those individuals that are unable to attend this morning. As noted on the screen, open enrollment started Monday and continues through December 4th, and changes cannot be made after that date, so be sure to mark your calendars. So what is open enrollment? As noted on the screen, open enrollment is the only time of the year you can make changes to your coverage without a qualifying life event. As mentioned on the previous slide, open enrollment ends December 4th, and elections received after that date will not be accepted. If you're not sure what your current elections are, you certainly can check with Linda in the Treasurer's office. By now, you should have either received the email containing instructions and the open enrollment handouts, or received printed copies from your department head. If you have not received the information, either contact your department head or Linda back in the Treasurer's office. During open enrollment, you can make changes to your coverage, like switching from one medical plan to another, add or drop coverage, or add or remove dependents. As noted on the screen, if you decide to add any dependents that are currently not covered today during the open enrollment period, additional forms are required, and you should contact Linda to see if the additional form is needed if you're adding any dependents to the coverage. A bit earlier, I mentioned qualifying life events, and I want to take a moment to explain what that is. A qualifying life event is an event that occurs during the year, and it allows you to make a change to your insurance coverage outside of the open enrollment window. So on the screen are some examples which include marriage, divorce, birth, change in custody, etc. If you experience a qualifying life event, contact Linda in the Treasurer's office to make any changes, as you only have a 30-day window from the time of the event to make the change. If you wait beyond that time frame, then you'll have to wait until the following open enrollment to make the change or addition. All right, let's get into what's changing for 2021. As you can see on the screen, the medical premiums are increasing for the 2021 plan year. However, the plan designs, meaning deductibles, copays, coinsurance, etc., are not changing, and new benefit programs are being added. In 2021, a new teledoc virtual visit benefit and a cancer care program is being added. The other great supplemental benefits that you have available to you today, such as host care, one call, script sourcing, and the lab card, are all remaining for the 2021 plan year. We will be covering the new benefit programs and your current benefit programs later on in the presentation. So even though the benefit designs are remaining the same, I want to take a few minutes to review the medical and pharmacy plans available to you. At Ogle County, you have the choice between two plans. You have a $750 single deductible plan and a $1,500 single deductible plan, both of which are summarized on the screen here for you. The coinsurance is the same for both plans, and coinsurance is applied after the deductible is met. The pharmacy benefit is also the same for both plans. But as noted on the screen, I want you all to remember not to forget that both plans require maintenance prescriptions to be filled via mail order or at a CVS location. Other differences between the two plans are the out-of-pocket maximums and co-payments for physician services. On the screen, you'll see the new 2021 monthly rates. There will continue to be wellness and non-wellness rates, so be sure to get your screening to start the year off with wellness rates. For those of you who waived the coverage with Ogle County, we wanted to take the time to remind you of the newer declination of coverage payment option. Ogle County will pay up to $1,200 annually should an employee obtain health insurance coverage from another source other than the county. The payment is made the following year. So if you waive coverage for this 2021 year, you'll receive your payment the first payroll of 2022. In the open enrollment materials in your supplemental benefits guide, there's some more information on this declination of coverage payment if you're interested in taking advantage of that. So we often get asked, which plan should I choose? So we put together this plan decision matrix, and it is in your benefits booklet that was sent out with the open enrollment materials. And when choosing which plan will work best for you, consider your anticipated plan utilization for things like doctor's visits, medications, or other healthcare services. You also need to consider the difference in premium between the two plan options. The $1,500 plan option has lower premiums. For example, the wellness rate for single coverage for the $1,500 plan is $375 less than the $750 plan. Lastly, you need to think about your overall maximum potential and what you can afford. Keep in mind that should you need a major procedure, hospitals usually will establish a payment plan with you. As discussed earlier, the pharmacy benefits are the exact same for both plans, and so that won't be a deciding factor in choosing which plan is best for you. Ogle County, again, will be sponsoring a wellness program, like I mentioned, with the wellness and non-wellness rates. And just like last year, your main focus right now should be to get your screening should you want to participate. The deadline to obtain the screening is a little bit longer than open enrollment, and it goes through December 18th. Check with your department head first, as many of the departments within the county are sponsoring on-site screenings this year. If your department is not sponsoring one of those on-site screenings, contact Denise at extension 360 to schedule a screening. As far as additional wellness program details, they'll be provided towards the end of this December, so be on the lookout for more details then. Quick review of the dental benefits. There's no changes to the dental benefits. The $1,200 annual maximum and the $1,000 lifetime ortho maximum will remain the same, along with the underlying coverage provisions. So we just recommend that you be sure to get your preventive cleaning when you are able to do so. Ogle County will continue to offer both the medical and dependent care tax advantage accounts. So if you would like to again participate in these benefits this year or enroll in these benefits, you must complete an enrollment form and return to Linda by the December 4th deadline. Both accounts allow you to pay for expenses with pre-tax dollars. The medical reimbursement account allows you to pay for qualifying medical, dental, and vision expenses. Examples of qualifying expenses include co-payments, co-insurance, etc. And included in your guide that went out with your open enrollment materials, there's additional examples of qualifying expenses that you can use with those pre-tax dollars. One thing that's newer this year is the IRS did change the allowable expenses to again include over-the-counter items such as pain, allergy, and cold medicines without a prescription. And women are able to use these pre-tax advantage accounts to pay for feminine products. So that's something that you should factor in terms of consideration on whether or not you want to participate in the account or maybe how many dollars you want to put into the account. You are allowed to contribute up to $2,750 into the medical account and up to $5,000 into the dependent care account, assuming a spouse is not also contributing to a dependent care account. However, that said, you don't have to contribute those full amounts. The election amount is up to you. Included in your open enrollment materials was a newer supplemental benefit communication that was produced earlier this year, and it includes more detailed information about programs available to you through the Ogle County Healthcare Plan. And we're going to take a little bit of time to review some of the information in this communication because it has a lot of great details and things that can help you maximize your benefits. So I would recommend that you take some time to review it as well, because again, it will be helpful to you and your covered dependents. So when viewing the guide, I would recommend that you be sure to pay special attention to these two pages that you see on your screen, one called Getting the Most Out of Your Benefits and one called Hints and Tips, because there is helpful information and reminders contained on these two pages. Okay, so now we're going to take a little bit of time and talk about one of the two new benefit programs available to you come January 1st. The first new program is called Teledoc, and Teledoc is offered at no cost to you or your covered dependents. There are no copays or coinsurance for you and or your dependents when utilizing this service. Teledoc allows you to speak with a physician 24/7 via your computer, mobile device, or phone when you are not well. In a few slides, I'll be sure to cover the common conditions treated via Teledoc. Teledoc provides you, again, 24 access via phone, mobile app, 24 hours a day, 7 days a week. And you can see on the screen there, Teledoc can be used for non-emergent medical issues. You know, maybe if your primary care doctor is not available, nights and weekends when other service providers are closed and your only other option would be the emergency room, or when traveling. Ogle County added this benefit as a way to help provide additional access to doctors. Many of us have had a difficult time getting in to see our own physician, or in the off hours have not wanted to go to urgent care or ER for something that can be treated by a physician, you know, due to the pandemic. And so this alternative is being offered to everybody. As shown on the screen, the physicians are both licensed and credentialed and have an average of about 15 years experience. And the average consultation is about 14 minutes long. So here's the listing of the most commonly treated conditions. However, not every condition that can be treated is listed on the screen. You know, for example, I personally had poison ivy earlier this year, and I was able to see a doctor virtually through a similar program and obtain the oral steroids that I needed to clear up the rash. It worked really well for me, and I was really pleased with the outcome. So considering the fact that it doesn't cost you a copay or cost anything to contact Teledoc, I would recommend, if you're not sure, to go ahead and outreach to them because it's not going to hurt. So the best thing to do before you need to actually use this benefit is to set up your account. Setting up your account includes completing a quick medical history so that if or when you need to see a doctor, the information is already in the system, and would include things just kind of like prior surgeries, current medications that you're taking, current diagnoses, etc. You can either call the 800 number, or you can visit the website listed there on your screen to set up your account. More information is included in this supplemental guide and includes the 800 number and the website for you to go to get this started. Here's a sample of what that website looks like. And not only can you activate your account like I just mentioned and complete your medical history, you can also request a consultation here. And there's a place for you to get answers to frequently asked questions, print an ID card if you wanted to have it with you, etc. So in terms of how do you actually use Teledoc, well, you can request a consultation by either calling, logging onto the website, or through the mobile app. Magnets, that little kind of purple box up there in the left-hand top of the screen, is what they look like, have been ordered, and the treasurer's office is distributing them to the various departments so that you can have the information at your fingertips. If you prefer to have an appointment, you certainly don't have to have an appointment, right? That's available 24/7. But if you wanted to, you could schedule one. They are available between 7 a.m. and 9 p.m. and you'll schedule it, and then the physician will actually outreach to you. So that's something that you can do as well. Okay, now we're going to talk about a new program, Cancer Care. Cancer Care is an additional health benefit provided to you by Ogle County. Cancer Care specializes in helping individuals deal with cancer. They have resources to guide you or your dependents through a potential diagnosis and subsequent treatment. The day you find out you or your loved one has cancer, you can call or register online to get help. They will provide you with a dedicated nurse to help you navigate the process and answer any questions you may have along the way. We do want to stress that participation in this program is strictly voluntary. You are not required to participate whatsoever. Ogle County really just wanted to provide additional support to those individuals that desire it. And more information is included in that supplemental benefits guide, should this be a program that you want to take advantage of. Couple reminders on current programs that you have. The first one is script sourcing. Script sourcing allows you to obtain certain prescriptions via mail order at no cost to you. Ogle County is going to continue to offer this program, and we just wanted to put a reminder out there that the list of covered prescriptions is constantly being updated. So if maybe your prescription wasn't available before when this program was rolled out, or maybe when you sought it earlier this year, it's worth checking back periodically to see what new prescriptions have been added. And you can do that easily by contacting Script Sourcing direct via the phone or the website. Another reminder is host care. Host care is a benefit for certain surgical procedures, such as those shown on the screen. It is really kind of like a domestic medical tourism type of a benefit. If you need a surgical procedure, I suggest checking with host care to see if you qualify for the program. If you do, the procedure will be free to you, meaning no deductibles, coinsurance, etc. And they make every effort to provide the service close to your home. However, the best surgeon may not be within driving distance. And so the benefit does include airfare, hotel accommodations, and quite possibly even a cash incentive for you. I know many Ogle County plan participants have taken advantage of this benefit and have really positive experiences. So if you're potentially in need of any of those types of services, and they do have additional ones that I don't have listed here on the screen, it's worth contacting host care for additional information just to see if it's an option for you. Another reminder is the lab card. When going through the lab card for covered lab work, there are no copays, deductibles, or coinsurance. So this year, to remind everybody of this benefit, actual lab ID cards are being mailed to every covered member's home this year. And an example of that card is on your screen. With the card, you will get more information about the program and a list of frequently asked questions and answers. The flyer on the left side of your screen is included in the supplemental benefits guide, and it does explain how to use the program. We did want to do a specific call out though for Rochelle Community Hospital because the process is slightly different when utilizing that provider, and we have a note in there just to make sure that if you choose to use that provider for lab services, there's just a different protocol, so make sure you take note of that. And similar to the lab card is the one call benefit, and this is for radiology services. So things like an MRI, a CT, or a PET scan. This benefit doesn't necessarily provide those services free of charge, but it does drastically help reduce your out-of-pocket costs for these services. So in order to take advantage of this program, you need to actually contact One Call and schedule the scan through them. And then once you do that, it will help lower your overall, like I said, out-of-pocket costs. This particular flyer is in the supplemental benefit guide, and it includes their number and that explains how to get any of those types of services scheduled should you need to utilize that. So we're getting near the end, and as we kind of start to wrap up the presentation, I wanted to remind you that if you're making a change, you need to get the change form shown kind of on the left side of your screen to Linda by December 4th. On the right side of the screen, if you're enrolling or re-enrolling in the Flex program, you have to get the 2-page flexible spending account form back to Linda by December 4th. I really recommend not waiting to the last minute, as you never know what might come up. And it is best to get these forms in as soon as possible, especially if you know what you would like to elect for this upcoming year. If you're not making any changes and you do not want to participate in either the medical reimbursement or dependent care accounts in 2021, you don't have to turn in any forms. So these forms are only required if you want to make a change or, like I said, re-enroll or newly enroll into either the medical or dependent care flex programs. All right, that kind of concludes our overview. Everybody is on mute, but so if you have a question, this would be a great time to ask questions. Make sure you go ahead and unmute yourself, or you definitely can go through the chat feature. I'm not seeing any questions through the chat feature at this time. Does anybody have any questions? All right, I'm going to take the silence as a no. You definitely can reach out to Linda if you have any questions. You can contact your department head or any of the healthcare committee members. And then you certainly can, reach out. I know many of you, I've had conversations with you individually. You're certainly happy to, welcome to reach out to Holmes Murphy, reach out to myself or Tiffany, another member of the team, if you have any questions or have any personal questions that you maybe want some help with. So we appreciate your time today. This presentation will be provided to Linda and also the Healthcare Planning Committee members, and then a couple department heads have also requested it. So if you would like to view it again, or if you know of coworkers that were not able to attend, this will be available for them. All right, thank you everybody. We just ask that you enjoy the rest of your week and stay safe.